Did you know that over 2 billion people around the globe suffer from fatty liver disease? This condition can go unnoticed for years and, if untreated, can lead to non-alcoholic steatohepatitis, NASH, inflammation of the liver, and liver fibrosis, cirrhosis. What triggers fatty liver? Excessive alcohol consumption isn't the only cause of fatty liver damage. Factors such as eating excessive processed foods, too much sugar and vegetable oils, taking too many painkillers, and viral infections can also cause damage to the liver. Liver damage occurs in stages, starting with fat accumulation and inflammation, leading to fibrosis and potentially cirrhosis if not addressed. Good news is you can get 100% repair and regeneration of your liver, but you must act before the point of no return. While certain foods and supplements can indeed promote liver health, it's vital to shift our perspective from merely treating symptoms to addressing the root causes of the issue. In this video, we'll talk about fatty liver disease stages, signs and symptoms that you must be aware of. We'll go over food, best supplements, and lifestyle changes that treat and reverse fatty liver and improve your liver health. Busting myths about fatty liver disease. One common myth is that being overweight or obese directly causes fatty liver disease. While there is a clear link between the two, it isn't a straightforward cause and effect relationship. Many people carry extra weight without experiencing any metabolic problems. On the other hand, type 2 diabetes and insulin resistance are much more closely associated with fatty liver. Over time, elevated insulin levels can create a congestive state in the body, leading to improper storage of excess nutrients, which adversely impacts liver function. This situation often falls within the scope of metabolic syndrome, characterized by insulin resistance, high blood pressure, elevated cholesterol, and increased waist circumference. Monitoring cholesterol levels is important. It's crucial to assess the type of cholesterol present. Simply having high total cholesterol or LDL levels doesn't necessarily signal a health emergency. The size and health of cholesterol particles provide better insight into inflammation and oxidative stress. Contrary to popular belief, not all fats are harmful. In truth, sugary foods, sodas, and added sugars, particularly high fructose corn syrup, are often the main offenders behind fatty liver. Sugar not only promotes fat buildup in the liver, but can also be toxic to liver cells. How does fatty liver disease occur? Excess caloric intake. Fat cell dysfunction. When you consume too many calories or unhealthy foods, refined carbohydrates, saturated fats, and trans fats, too much sugar and fast food, fat cells expand until they reach their limit. Beyond this point, they become dysfunctional, lose blood supply, and become inflamed, leading to scar tissue formation. Ectopic fat storage. When fat cells can no longer store fat, excess fat accumulates outside the cells, resulting in ectopic fat. This fat interferes with organs, especially in the abdomen. 59% of liver fat comes from ectopic fat originating from other parts of the body, and 26% comes from the liver itself, producing fat from glucose through gluconeogenesis, a process that is normally inhibited by insulin. Insulin resistance is when body cells become less responsive to insulin, a hormone produced by the pancreas that helps regulate blood sugar, glucose levels. Normally, insulin facilitates the uptake of glucose from the bloodstream into cells, where it can be used for energy or stored for later use. When insulin resistance occurs, the body's cells, particularly in the liver, muscle, and fat tissues, do not respond effectively to insulin, leading to elevated blood sugar levels. This contributes to conditions like diabetes and prediabetes. What factors contribute to fatty liver disease development? Besides diet and insulin resistance, also important to note, alcohol consumption. Alcoholic fatty liver disease results from excessive alcohol consumption. Alcohol metabolism in the liver generates acetaldehyde, which can be toxic and lead to inflammation and fat accumulation in liver cells. Obesity. Excess body weight, especially when concentrated around the abdomen, visceral fat, increases the risk of fatty liver disease. Fat cells release free fatty acids into the bloodstream, which can be taken up by the liver, leading to fat accumulation. Sedentary lifestyle. lack of physical activity contributes to obesity and insulin resistance, both of which are significant risk factors for fatty liver disease. Regular exercise helps regulate body weight and improves insulin sensitivity. Medications and toxins. Certain medications, like corticosteroids, and exposure to environmental toxins can lead to fat accumulation in the liver, as they may disrupt normal liver metabolism. Genetics. Genetic predisposition can also play a role. Some individuals may inherit a tendency to develop fatty liver disease, especially those with a family history of liver disease or metabolic disorders. If fatty liver disease is not addressed, it can progress to non-alcoholic steatohepatitis, NASH. In some cases, fatty liver can lead to inflammation, which can cause liver damage and fibrosis, and liver fibrosis, cirrhosis. Continued inflammation may lead to scarring of the liver, fibrosis, and in severe cases, cirrhosis, which can impair liver function and lead to serious health complications. Stages of fatty liver disease. Understanding the stages of fatty liver disease can shed light on its reversibility and how to address it effectively. Stage 1. At this initial stage, a healthy liver can develop fatty infiltration, termed non-alcoholic fatty liver disease, NAFLD. In this stage, liver cells may be filled with fat, but no damage has occurred yet. Stage 2. If the condition progresses, it can evolve into non-alcoholic steatohepatitis, NASH. This stage is characterized by inflammation that is more severe and can lead to the breakdown of liver cells. Blood tests may show elevated liver enzymes, such as ALT and AST, indicating liver distress. Stage 3. Prolonged inflammation can result in scarring or cirrhosis, which is often irreversible. However, most individuals with fatty liver remain in the earlier stages, where the condition is still treatable with mostly lifestyle changes. Role and functions of the liver. The liver is a vital organ with numerous essential functions critical to overall health. Understanding the liver's roles emphasizes the importance of maintaining its health through supportive dietary and lifestyle choices. Here are some of its primary functions. Metabolism regulation. The liver plays a central role in metabolizing carbohydrates, proteins, and fats. It converts glucose to glycogen for storage, regulates blood sugar levels, and synthesizes cholesterol and triglycerides, which are important for energy and cellular function. Detoxification. The liver detoxifies various metabolites and harmful substances, including drugs, alcohol, and environmental toxins. It converts these substances into harmless compounds that can be excreted through urine or bile. Bile production. The liver produces bile, a substance essential for digestion and the absorption of fats and fat-soluble vitamins, A, D, E, K. Bile also helps eliminate waste products, including bilirubin, which is a byproduct of the breakdown of red blood cells. Nutrient storage. The liver stores essential nutrients, including vitamins such as B12 and D, minerals like iron and copper, and glycogen. This storage capability helps maintain nutrient balance in the body and provides energy during periods of fasting or increased demand. Blood clotting factor production. The liver synthesizes proteins necessary for blood clotting, coagulation factors, as well as albumin, which helps maintain blood volume and pressure by regulating fluid distribution in the bloodstream. Immune function. The liver plays a role in the immune system by producing immune factors and filtering bacteria and toxins from the bloodstream. It houses Kupffer cells, which are specialized macrophages that help detect and clear pathogens. Hormone regulation. The liver is involved in the metabolism and regulation of various hormones, including insulin and glucagon, which are crucial for blood sugar control. It also processes steroid hormones, helping to maintain hormonal balance. Synthesis of cholesterol and proteins. The liver synthesizes cholesterol, which is vital for cell membrane integrity and the production of certain hormones. It also produces proteins like clotting factors and enzymes essential for digestion. Signs of liver damage. Next, let's go through key signs and symptoms that may indicate liver damage. Pale stool. Stools that are pale or clay-colored can signal liver damage. The liver produces bile, which gives stool its brown color. When bile flow is obstructed, stools may lighten and even float due to unprocessed fats. Nyctalopia, poor night vision. Difficulty seeing in low light can suggest liver issues. The liver helps transport vitamin A through a protein called retinol-binding protein. A damaged liver can cause vitamin A deficiency, impacting night vision. Swollen. Right foot, peripheral edema, or swelling in the legs and feet, can occur when the liver doesn't produce enough albumin, a protein crucial for maintaining fluid balance. This fluid buildup often affects the right side more due to blood flow patterns. White or yellow bumps. Around the eyelids. This is called xanthelasma and is caused by cholesterol deposits. These can indicate liver dysfunction, as the liver struggles to metabolize cholesterol. Right-sided pressure. A sensation of pressure or discomfort in the right rib cage, especially post-meal, may suggest liver problems. When your liver becomes congested with an excess of fat, the liver swells and gets inflamed. This swelling exerts pressure on the phrenic nerve that runs along your right side and that can cause pain in the upper right back muscles or your neck, purple or red bumps on the skin. A compromised liver may not produce sufficient proteins for blood clotting, leading to easy bruising and unusual purple or red spots on the skin, commonly seen on the lower legs and arms. Cracked heels. The liver utilizes stored vitamin B3, niacin, for repair, and a lack of it can result in dry, cracked skin on the feet. White or swollen nails. White or swollen nails may signal serious liver damage or blood oxygen supply issues. Studies show that 8 out of 10 individuals with severe liver scarring had completely white nails, indicating a strong correlation between nail appearance and liver health. Clubbed nails, characterized by rounded, enlarged fingertips, may indicate chronic hypoxia, often linked to liver diseases like cirrhosis. Dark urine, dark yellow or brown urine may signal liver damage. The liver processes waste products, including bilirubin, a yellow pigment. If the liver can't effectively filter bilirubin due to damage, it can accumulate and darken urine, indicating various liver conditions like hepatitis, cirrhosis, or liver cancer. Spider veins. Also known as telangiectasia, spider veins are small, dilated blood vessels visible on the skin's surface, suggesting liver issues. When the liver is damaged, estrogen levels may rise, resulting in increased pressure in the veins and the appearance of spider veins. Itchy skin. Itchy skin is a common symptom of liver damage, often caused by bile acids accumulating under the skin when the liver fails to filter them effectively. This buildup can increase histamines in the bloodstream, causing itchiness and leading to dry, flaky skin. Fatigue. Persistent fatigue is one of the most common symptoms of liver issues. If you find yourself feeling unusually tired or lacking energy with no apparent reason, it could indicate that your liver is struggling to function properly. Abdominal discomfort. Individuals with fatty liver disease may experience discomfort or pain in the upper right abdomen, where the liver is located. This discomfort can manifest as a dull ache or a sensation of fullness. Weight gain or obesity. Fatty liver disease is often associated with weight gain, particularly around the abdomen. If you notice an increase in waist circumference or difficulty losing weight despite efforts, it may be a warning sign. Elevated liver enzymes. Routine blood tests can reveal elevated levels of liver enzymes, such as ALT, alanine aminotransferase, and AST, aspartate aminotransferase, which is correlated with inflammation or damage to liver cells. Jaundice. Jaundice, characterized by yellowing of the skin and eyes, can occur when the liver is unable to process bilirubin effectively due to fat accumulation. This symptom typically indicates a more advanced stage of liver dysfunction. Insulin resistance. Fatty liver disease is closely linked to insulin resistance, which can lead to type 2 diabetes. Symptoms of insulin resistance, such as increased hunger, sugar cravings, or difficulty losing weight, may warrant an assessment of your liver health. Constant cold sensitivity. Individuals with low thyroid function often report feeling unusually cold or having difficulty maintaining a normal body temperature. This sensitivity to cold can stem from decreased metabolism due to insufficient thyroid hormones, which are crucial for temperature regulation. If you frequently feel cold in comfortable environments, it could indicate hypothyroidism, potentially linked to liver dysfunction. If you experience any of these signs and symptoms, keep watching. We'll explain what you can do to start improving your liver health today. When it comes to fatty liver disease, we must first eliminate the factors that contribute to its onset. Most positive change will arise from stopping the behaviors or consuming the substances that harm the liver. Once we address those harmful factors, we can provide the necessary nutrients and support for liver recovery. Recognizing the right order of actions is essential. To effectively treat fatty liver, it's crucial to understand the mechanisms behind it, particularly those linked to metabolic syndrome and insulin resistance. Overload. The liver often becomes overwhelmed by excess sugar, alcohol, and toxins. While glucose from foods like bread is processed by various cells throughout the body, fructose, found in sugar, must be metabolized by the liver, contributing to this overload. Inflammation. Low-grade chronic inflammation, frequently associated with metabolic syndrome, exacerbates liver issues. This inflammation can be intensified by vegetable oils high in omega-6 fatty acids, creating a pro-inflammatory environment. Lack of resources. The liver requires specific nutrients to function optimally. Amino acids like methionine and cysteine are essential for producing glutathione, the body's primary antioxidant. Additionally, choline, a B vitamin, is vital for energy production and fat metabolism in the liver. By reducing the intake of harmful substances like alcohol, sugar, and processed foods, while ensuring adequate nutrient intake, we can support liver function and promote healing. Addressing these underlying issues is vital for reversing fatty liver disease and improving overall health. You can reverse liver disease. 1. Practice intermittent fasting. Intermittent fasting can give your liver a break, helping reduce fat accumulation, improve insulin sensitivity, lower inflammation, and promote the liver's natural detoxification processes. 2. Avoid processed and sugary foods. Limit intake of sugary, starchy, and processed foods like bread, pastries, pasta, and soda. Fructose can affect a fatty liver similarly to alcohol, so eliminating sweet fruit juices and alcohol is crucial for healing. 3. Consider purified bile supplements. To reduce inflammation and cleanse fatty deposits, consider supplements like TUDCA, tauroursodeoxycholic acid, or digestive enzymes containing ox bile. These can help eliminate fat from the liver and prevent gallbladder stone formation. 4. Stay hydrated. Aim to drink at least 2 liters of water daily. Proper hydration helps thin the blood and aids the liver in bile production, which is essential for breaking down fats. 5. Use liver-cleansing herbs and spices. Add herbs and spices like ginger, turmeric, cinnamon, dandelion root, milk thistle, reishi mushrooms, green tea, and cloves to your diet. These can help reduce inflammation and support detoxification. 6. Eliminate inflammatory seed oils. Avoid inflammatory seed oils such as corn, canola, and soybean oil, which can harm liver health. Opt for healthier fats like butter, extra virgin olive oil, and coconut oil. 7. Avoid alcohol. This is certainly wise, as alcohol is a known liver toxin, especially in excessive amounts. Alcohol consumption activates specific genes that instruct the liver to store fat rather than burn it for energy. 8. Weight loss. While shedding pounds can be beneficial, it isn't the underlying cause of fatty liver. As we've discussed, weight loss alone won't resolve the core issues. 9. Diabetes medications. Given the link between diabetes and fatty liver, managing blood sugar with medication is common. However, medications like insulin can worsen insulin resistance over time, creating a cycle where the body becomes less responsive to insulin, ultimately worsening fatty liver. 10. Vitamin E and thiazolidinediones. While these treatments may have some benefits, they do not address the root cause of the issue. Thiazolidinediones can help shift fat from the bloodstream to subcutaneous fat cells, alleviating some metabolic problems, but potentially leading to weight gain. This creates a paradox where efforts to improve insulin resistance might be undermined by the side effects of the very medications designed to help. And now, some dietary considerations to support liver health. Focusing on nutrient-rich foods is essential. Here are some key dietary resources. Amino acids, found in beef, chicken, pork, and eggs. These are crucial for glutathione production. Glutathione is a powerful antioxidant found in every cell of the body. Often referred to as the body's master antioxidant, glutathione plays a crucial role in detoxification. The liver uses glutathione to detoxify harmful substances, including drugs, heavy metals, and environmental toxins. It conjugates with these compounds, making them water-soluble and easier for the body to excrete through urine or bile. Glutathione is also fundamental in immune system support. Choline. Important for fat metabolism, choline is an amino acid abundant in eggs, liver, dairy products, and seafood. Choline is generally safe when consumed in dietary amounts, but excessive choline supplementation can lead to side effects such as fishy body odor, vomiting, and low blood pressure. Cruciferous greens and liver health. Incorporate sulfur-rich foods. Consume foods high in sulfur, such as leafy greens, garlic, broccoli, Brussels sprouts, kale, cabbage, mushrooms, pastured eggs, oily fish, walnuts, onions, and scallions. These foods help raise glutathione levels, which aid in detoxification and breakdown of toxins. Supplements to consider. For addressing fatty liver disease, here's an extended list of options, along with their benefits, safety considerations, and dietary sources. Milk thistle, a well-known herbal supplement, contains silymarin, a compound that protects the liver from damage and promote regeneration. Clinical studies indicate that silymarin supplementation can lead to reduced liver enzymes, ALT and AST, and improved overall liver function in patients with fatty liver disease. It is generally well tolerated, though some individuals may experience gastrointestinal upset or allergic reactions. Milk thistle is typically available as a supplement in capsule or extract form. Vitamin E is a fat-soluble antioxidant that shows promise in treating non-alcoholic fatty liver disease, NAFLD, particularly in non-diabetic patients. It works by reducing inflammation and oxidative stress in the liver. A recent review supports vitamin E's efficacy in enhancing liver fibrosis, steatosis, and enzyme levels. While vitamin E is generally considered safe, high doses can increase the risk of hemorrhagic stroke. Discuss dosage with your healthcare provider, especially if you are on blood-thinning medications. Vitamin E is abundant in nuts, seeds, spinach, and broccoli. Whenever possible, obtaining it from food sources is preferred. Alpha-lipoic acid is an antioxidant that may assist with fat metabolism and has shown potential in mitigating liver inflammation and oxidative damage. Studies indicate that ALA can improve liver enzymes in patients with NAFLD and aids in weight loss. ALA is generally safe, but can cause minor side effects, such as skin rash or gastrointestinal upset. It may also lower blood sugar levels, so monitoring blood sugar is crucial, particularly for diabetics. ALA is found in small amounts in foods like spinach, broccoli, and potatoes, but is often taken as a supplement for therapeutic doses. Berberine, a bioactive compound found in several plants, recognized for its antimicrobial and anti-inflammatory properties. It has gained attention for its role in metabolic health. A meta-analysis involving over 500 patients indicated that berberine positively affects liver function, blood glucose levels, and cholesterol in individuals with fatty liver disease. It appears to influence gut microbiota and increase levels of GLP-1, a hormone important for insulin regulation. Berberine is typically well tolerated, but it can cause gastrointestinal upset in some individuals. While berberine is mainly taken as a supplement, it can also be found in foods like barberry, golden seal, and Oregon grape. CoQ10 is a naturally occurring antioxidant in the body, known for its role in energy production and combating oxidative stress. CoQ10 is generally safe, but may interact with anticoagulant medications, potentially altering their effects. CoQ10 can be found in small amounts in fatty fish, organ meats, whole grains, and cruciferous vegetables, but dietary intake may not suffice for therapeutic benefits. Also, consider taking omega-3 fatty acids. A meta-analysis published in Clinical Nutrition in 2018 showed the supplementation with omega-3s, especially fish oils like DHA, was associated with an improvement in liver markers like ALT and AST, as well as with a reduction of liver fat. Food as medicine, supplements as support. In conclusion, 1. To reverse fatty liver, start by identifying what's causing it: inflammation, toxic overload, or lack of resources. Detoxify. 2. Promote liver health. Maintain a balanced diet, ensure adequate bile production through dietary fat, and manage stress. Practices like intermittent fasting, proper diet, relaxation, regular exercise help support liver function and overall health. 3. Support liver function and overall metabolic health through informed dietary choices. With commitment and proper care, the liver has a remarkable ability to heal itself. Early action can lead to complete liver repair and regeneration. Stay tuned for our Part 2 video on fatty liver and complementary approaches. It's not all about your genes, it's a lot about your choices.